right, good afternoon. Thank you, Dr. Dumovic, for introducing me and for inviting me to speak to everyone today. So I am the clinical pharmacist at UNC Neurology. I'm based at our Meadowmont location, but help patients in both that location as well as our TM Clinic Hillsborough Hospital location. So today I'm gonna go over navigating health insurance, everyone's favorite topic, because I know that, or I'm sure that everybody has come across some sort of very frustrating situation with their own health insurance. And so that's something, in addition to medications that I talk about every single day, I'm talking about insurance every single day. So definitely something that hopefully, I can help you navigate as a clinical pharmacist. So some things that I want to be sure that we go over today is to discuss different types of insurance and who's eligible for each. I think before we talk about insurance issues, it's important to lay some groundwork, like what sort of insurance is out there. Also define some important insurance terms that are applicable to multiple types of insurance. Also identifying types of medication assistance programs. So this is where we're going to get into kind of the meat of, okay, what can we do if we're having an insurance issue and how do we navigate that? And also discuss briefly some options for non-specialty medications, because a lot of what we talk about for NMOSD, TM, MOGAD, they are specialty meds or infusions. But as we've talked a lot about today, there are also medications that we use for your everyday symptoms that are not kind of targeting the underlying reason or kind of the autoimmune process that we're using our specialty meds for. So I want to be sure to touch base on that as well. Okay, so I promised that we would go over the types of insurance. There's government-based insurance as well as privately owned insurance. So what does that mean? Government-based is basically just funded full or in part by the federal or state government. So that's going to be your Medicare, which is federally funded, Medicaid, which is North Carolina state funded. It used to be federal, but now it's state. TRICARE, which is federally funded. So then when we talk about privately owned, or you may hear me say commercial or kind of use those terms interchangeably, that's paid for by the patient. So that is distributed by these private companies and benefit managers. And usually, or a lot of the times, this can be through your employer, or you can sign up for a privately owned plan through healthcare.gov. But some examples of this would be like Blue Cross Blue Shield, UHC, Cigna, Aetna, et cetera. All of these companies that I've mentioned will have the Blue Cross, UHC, Cigna, Aetna. They will have like basically two different arms, so that they have one umbrella company and they have a like private or commercial arm, and then they have a Medicare arm. So you may also hear these companies mentioned when we're talking about Medicare plans as well. And speaking of Medicare, so that's going to be our first bucket of insurance that we talk about. So who is eligible for this type of plan? That's going to be your patients that are age 55 or 65 and older, and patients also with certain diagnoses or past medical history, and they can be less than 65 years old. So this goes into Social Security disability, which I'm not going to touch super in depth into that, but it's kind of what I'm alluding to here. And I want to be clear, so there's three main parts of Medicare. So there's Medicare Part A, and that's going to be covering your inpatient or hospital costs. Medicare Part B, as in boy, so that's going to be your outpatient or durable medical equipment, DME. And then Medicare Part D, so that's going to be your medications, right? D for drugs. So Part D plans are supplemental and sometimes can also be called Advantage plans. So if you hear that, that's usually what that means. And it is possible to have only Part A and Part B, but not have Part D, because Part D is something separate that the patient has to pay for themselves. That is not federally funded. Well, not fully federally funded, only partly. So I wanted to make that distinction as well. There are a lot of other different kind of random parts. Part C, I've seen Part J before. Those are essentially all just different types of supplemental plans that can help cover different things that these three parts that I mentioned here don't cover. Next is going to be Medicaid. So I've put on the screen the eligibility for the year of 2025. I think that's important because it can potentially change from year to year. But the eligibility requirements I've put on the screen are directly from the Medicaid, the state Medicaid website. So you can go on there and look to see, there's more detail beyond what I've put here, but I just kind of wanted to be brief in terms of mentioning who could potentially qualify for Medicaid. So that could be pregnant patients, plus meeting that financial eligibility requirement, children age 0 through 18, an adult 19 through 64, and then patients with certain diagnoses or medical history regardless of age. Again, that kind of plays into the Social Security disability I mentioned with Medicare, and it is possible to have both Medicare and Medicaid. Medicaid will cover both medical and pharmacy-related costs, so not just one or the other. And the best way to know that you're eligible is to go online and apply, because they have all the eligibility there and basically screens that you click through to be able to tell you if you are eligible and what kind of Medicaid you're eligible for, because there are also different kinds of Medicaid. It's important to know that family planning Medicaid is not full Medicaid coverage. That is something that I see a lot. Patients that get approved for Medicaid, but in kind of the bottom portion of the form, it says family planning. That is only for like sexually transmitted infection medication, as well as birth control options, and that is it. So family planning Medicaid is basically like you were non-insured. So it's really important because that can be confusing depending on what your approval is from the state. So TRICARE is going to be our last type of government insurance. So who is eligible for TRICARE? That's going to be our uniformed service members and their families, National Guard and Reserve members and their families, former spouses, Medal of Honor recipients. Now, again, this is kind of like a brief eligibility criteria. If you would like to see the full eligibility criteria, you can go to, there's a full like list for that. And I think I might have actually put the Medicaid link up there instead of the TRICARE link. But there's a full list of those patients that are available for TRICARE, and then not only the patient themselves, but either family members or their spouses, etc. And there are multiple different types of TRICARE programs. And these different types of programs have different levels of coverage. So that's also important when we talk about medical and pharmacy costs, because some things may be preferred over others. The TRICARE system may have a preference about where you get your care, or if you have to have a referral for that type of care. So all those things go into your different types of TRICARE plan. However, generally the best coverage of care for TRICARE patients is going to be at your VA as well as your military bases. So that's just kind of a general thing that we see. Okay. Private or commercial insurance is our second kind of big bucket of insurance. So who is eligible for this? This is going to be any patient over the age of 18 and children or dependents on their adult commercial plans through the age of 26. So basically anyone that I have not mentioned up until this point could be eligible for a commercial insurance plan. Now these plans and Medicare Advantage plans are similar in terms of the types of costs that are associated with these plans, such as out-of-pocket costs that renew each year. Which, speaking of, what do all those insurance terms mean? And how do I know if my medicines are going to be covered, right? Because I think once we sign up for insurance, or if you're in the process of signing up for an insurance plan, all of these different terms can become really confusing. And I think just having some knowledge about these terms can give you a lot of power in terms of understanding your coverage and what your future costs could be. So the first term I want to go over is premium, right? So what is an insurance premium? That's going to be your monthly or your bi-monthly cost up front for your insurance plan. So that's going to be the cost that maybe comes out of your insurance or your paycheck, or the cost that you pay once or twice a month as a bill for your actual insurance plan. So then once you pay your premium and you have your insurance plan, what about copays, right? Because we see all these different types of copays for different things. You may see copays, copay numbers on your insurance card, or when you're signing up if you're comparing insurance plans. So copays are the dollar amount that, what I kind of describe as, get you in the door, if you will. So in your doctor's office or a minimum cost for a prescription. So the first part of that, going to the doctor's office, when you go to the front desk and you're checking in, they may say, okay, you have a $15 copay for your visit today. That's the money that you're kind of getting in the door to see your provider, but that is not the full cost of your visit, right? Same as when you go to the pharmacy to pick up your medication. If you have a generic medication, let's say for blood pressure, your copay may be $5 for that prescription. That is not the full cost of the drug, but that is the cost that your insurance has basically negotiated with the drug company to say, okay, when patients use this medicine, they have to pay this cost. Something common that we see associated with copays is like tiers, right? When we're talking about medicines, tier 1, 2, 3, 4, 5. Tier 1 is going to be your generic medications, the one that cost, they're most cost effective. Tier 5 is most likely going to be your specialty medicines, so your high dollar medicines, your specialty medicines, brand name medicines, insulin inhalers, that sort of thing. So that's what copay means. Next, I wanted to go over deductible, right? And deductible and out-of-pocket max kind of go hand in hand. So that's why I'm gonna also talk about them kind of not quite together, but one after the other. So your deductible is gonna be your dollar amount that you pay out of your pocket that once reached lowers your medical cost. So that does not mean that your cost would go to zero. But sometimes you can see a reduction of what your out-of-pocket is that you're actually paying. A lot of the times when you look at an insurance card, and I'll have an example of this as well in the next couple of slides, but you'll be able to see your deductible amount on your insurance card. And that can tell you, okay, I have to pay this amount out of my own pocket to reach my deductible. And that's that first kind of cost savings that you may see. So, well, how does deductible relate to out-of-pocket max? So your deductible usually feeds into the out-of-pocket max. And what the out-of-pocket max means is the dollar amount that you pay out of your pocket that once you reach it, your insurance fully covers your medical costs. So this is when your cost would be zero. So that's why I usually talk about them together, or that they're related, is because your deductible will usually feed into your out-of-pocket max. But all together, this is money that you're going to be paying to try to lower your healthcare costs for the remainder of the calendar year. For most insurance plans, so this is going to be commercial plans as well as Medicare Advantage plans, your deductible and out-of-pocket max will start over at the beginning of the calendar year in January, unless you're on a rolling type plan. Prior auths is also something that I know everyone knows and loves. Prior auths are unfortunately, something that we see a lot, but that means that we're no stranger to them, so that is totally okay, and we're here to help through that process. So prior auths are basically approval from your health plans that the insurance is saying, okay, your doctor's office needs to tell us that you need this, whether it be a service like imaging or a procedure or even a hospital stay. But the one that I deal with all the time is for medications, right? So your insurance is saying, okay, we need extra information from your doctor's office to say that you need this service or you need this medicine. Usually we have to submit additional like medical information or like details about your case in order to basically explain to them why you need the thing that you need. But I think it's important to remember that for Medicare Part D and private insurance plans, authorized and covered may not also mean that your service or medication is $0. I can't stress that enough. And I think that's also why I try to be really mindful when I am describing, okay, if something is authorized or approved versus covered, because I think that it can get really confusing. And I would just say that always assume there is a cost unless you know otherwise, and always ask for an estimate, especially if we're talking about a service, imaging, or an infusion. That's really important. Okay, so some things to remember. I've kind of alluded to these big kind of three things, but there's always exceptions to the rule when it comes to insurance plans. They vary so much just policy to policy, even if we're talking about plans all within the same kind of umbrella company. And unfortunately, plans can change without telling you. They may send you a very generic, letter in the mail, but something that is covered the first half of the year, something may change, and you may need a prior authorization the second half of the year. And, that's something that's different. That's just one example, but there's always exceptions to the rule. Paying into your deductible usually also pays into your out-of-pocket max. So a good example of this is, let's say your deductible is $1,000 and your out-of-pocket max is $3,000. That does not mean that you would need to pay $4,000 out of your own pocket in order to get completely covered health services. That means your total is $3,000 because your out-of-pocket max is telling you, okay, this is the total amount. Your deductible, remember, is that first kind of smaller dollar amount that can sometimes lower your healthcare costs. So it's not an additive situation. Reaching your deductible and your out-of-pocket max usually does not remove copays. So those costs that your insurance says, okay, the cost to get in the door or the cost for that insurance or your prescription at the pharmacy may still be there. Again, not always the case, but it may. I put up an example of like a Blue Cross Blue Shield insurance card. If you look kind of at the middle of the card, on the right-hand side, you'll see actually like DED, that is what deductible is, and then OPM right below that, out-of-pocket max. So you can actually see that on your insurance card and what it would be for in-network providers and out-of-network providers, as well as if you're insured just for you as an individual or you have other family members on your plan, because those numbers change, and that really just depends on how many people are covered on your plan. So some cards have this, some cards don't, but I wanted to put it here just as in case your card does have it, because I think that can also be really helpful in terms of anticipating your healthcare costs. Okay. I have two other terms I wanted to go over, and these are newer terms. Well, one of them is newer for 2025, the other one is not. So the term that is newer for 2025 is Medicare Prescription Payment Plan, or M3P. So what does that mean? And this is for Medicare patients specifically. So this is the first year that it was offered to Medicare patients and designed to eliminate the donut hole, if y'all have ever heard that term before. So anyone with a Medicare drug plan or health plan can actually opt into an M3P. Every Medicare plan is required to offer an M3P plan for their patients, but it's voluntary. So patients must be the ones to seek out to their insurance plan to say, hey, I want to sign up for this. The insurance will most likely not be like, hey, patient, do you want to sign up for this plan? No. So you need to tell them in order to be enrolled. And what this does is it spreads out your out-of-pocket costs for, like in this example, medications across the calendar year instead of paying your cost at the pharmacy. So if you have a medicine that is high dollar, instead of going to the pharmacy and having to pay that bill right then today, you can spread that cost out so that way you can pay it over the course of the year, which may actually be more affordable on a month-to-month basis instead of paying it all right then. The example I put on the screen is for insulin. So let's say you have an insulin prescription with a cost of $1,000, and you go to pick up, you find that out when you go to pick up at the pharmacy. If you enroll in an M3P plan, they will take that $1,000, and if this is January, divide it by 12, right? Because there's 12 months in a year. That means your cost would be $83 in addition to your normal premium, like for your insurance. So you would not have any cost when you go to the pharmacy to pick up your prescription. Your insurance instead would send you a bill every month for $83. So, I think that it's an option. It may not be for everybody, but if something like $83 is more affordable month to month instead of $1,000 right then, I think that that's something to keep in mind, especially for specialty medications. The second insurance term to know as it regards to Medicare is Medicare Low Income Subsidy, LIS, or it's also called Extra Help. So it's defined as the NC Department of Insurance as a Medicare program to help people with limited income and resources pay Medicare prescription drug costs. So for those with Medicare plans, if you apply and are approved for low income subsidy, it can lower your premium and also lower the costs of things like medicines and co-pays. Also will remove that out-of-pocket. This year, the Medicare out-of-pocket is $2,000. I think it mostly removes that. It lowers your drug co-pays to anywhere from $0 to about $11. So that it's really substantial. And if it's something that you're eligible for, again, online we'll be able to tell you if you're eligible for that, then it can be really, really beneficial. Low income subsidy does take about 3 weeks to hear back if you get approved or not. So it is not a kind of quick fix. It's something that in the moment, if we need it, is going to be kind of difficult, but long term, or especially if you were just signing up for Medicare, can be really great to have along with your insurance. Okay, so we've talked about all these insurance plans, right? We've talked about federal plans, privately owned plans, and all the things that we need to know in terms of, our terms about insurance. But what if with your insurance, your cost is still high for your medication? Like, what do we do in those situations? So part of what we do at UNC is we take these medication assistance programs. That's primarily going to be copay cards, grants, and manufacturer patient assistance programs, or free drug. And we help you navigate those things and apply for those things to apply to your medications. And this again is in addition to insurance, sometimes without insurance. So I'll get to that point as well. But the first bucket is going to be copay cards. So what are these and who is eligible for this? This is the option that I find that most patients are more knowledgeable or kind of have heard of before. You may see this on like drug commercials, or even at your pharmacy when you go to pick up, they may have little like cards like right there when you check out. So the patients that are eligible for copay cards are going to be patients with private, again, or commercial insurance. So if you have any type of federal or state funded insurance, you cannot use a copay card. And that just has to do with the limitation, like legal limitations of using them. But how does that copay card work, right? It looks just kind of like a card size thing with some numbers on it. Like, how does the pharmacy even use that, right? So first, the pharmacy will run your insurance plan using all the billing information from your insurance card. And then your copay card will have similar information, that like ID number, group, BIN, PCN that you're used to giving for your normal insurance. Copay cards will have that too. So your pharmacy will then run that after your insurance to either eliminate or significantly reduce the cost of your medication. And sometimes this will pay into your deductible. Those are really great cards. Sometimes they won't, but it can be really helpful to significantly lower costs. Copay cards do have to be renewed usually once a year, but they auto-renew, so you usually don't have to do any additional signing up for those type things. If you do, that's something that we usually help with. The next bucket is going to be grants. So when I describe this is going to be specific to our neurology medications and indications that we're talking about today. If you see other specialists or have other specialty medications at other specialties outside of neurology, this may be different. So I just kind of want to preface that as well in terms of eligibility and how they work. So for neurology medications, Medicare patients are eligible for grants. But what is a grant, right? Like, most people haven't really heard of this before. So grants are how I describe it is free money, essentially. It is not a loan. You do not have to pay the money back. But grants, the way that they are collected is by these third-party private groups. So like the Assistance Fund, the PAN Foundation, that sort of thing, where they will take money that is donated from either drug companies, private individuals, or foundations, and then disperse that to patients. So when you would apply for the grant online, And then if you're approved, then you can be approved either for a dollar amount, so let's say like $5,000, or for the whole year, regardless of cost. So those grants are the best. Those are the ones that we like. I mean, all grants are helpful, but similar to copay cards, what the pharmacy does is they will run your insurance, get the remaining cost, and then apply the grant to cover the remaining cost, so that way your cost is zero. So that's, in some cases, even better than a copay card, which is really nice. However, I think the big kind of catch with grants is how often does it need to be renewed? So that would be once yearly or when the grant funds run out, whichever is first. So those grants that only apply a set dollar amount, once you use up that dollar amount, then we either have to find you another grant or find another way to help offset the cost of that medication. So that can be a little bit tricky, especially, let's say if you have a $3,000 medication and your grant is only for $5,000, you're probably only gonna get like 1.5 fills out of that grant. So then what do we do next? Well, the what do we do next is usually manufacturer patient assistance programs, or manufacturer PAP. That's a kind of really big long name for free drug programs. So these programs are set up by drug companies, and in terms of eligibility, that can depend on the individual program. So it's important to know that criteria, and that's something that we can find out for you, or something that is like publicly available, usually online. You will also have to meet some sort of financial eligibility and potentially coverage eligibility. So if you have insurance or not, that can determine whether or not you can use that program from the drug company. But how do they work? So if you're approved, then your medication is provided to you at no cost directly to you. These programs, especially when we're talking about specialty drugs, they will contract with their own pharmacy. So your like local pharmacy, your CVS, Walgreens, Walmart, they aren't even like in that process. The drug company, once you're all approved, they will send your prescription to their pharmacy, and then that pharmacy contacts you, the patient, directly, and they will ship it to you. So we also are not involved in that process beyond just sending your prescription. However, so at UNC, we do have myself and then a pharmacy technician. We work behind the scenes to help get you approved and like go through the application of all those free drug programs. So we, in that sense, we are also involved. So we're just more kind of behind the scenes, if you will. But how often does it need to be renewed? So these are program dependent, but mostly they're once a year. Some are more frequent. Again, it just kind of depends on eligibility. But I think one thing, especially that we're lucky in neurology, is that for a lot of free drug programs outside of neurology, you are required to have no insurance at all, be completely non-insured. However, a lot of the neurology free drug programs, you can have some form of insurance and still be approved for free drug, especially if you have a prior auth denial and an appeal denial. So we call that kind of like a double denial. Then you could be eligible to apply. So just because you have insurance doesn't necessarily mean that you can't use free drug. I think that's always we need to look into it and see what's there, see what you're eligible for. So I wanted to kind of dispel that myth as well. I have put on the screen the most common specialty medications for NMOSD, MOGAD, and TM. And have denoted whether or not there's a copay card, a grant, or a free drug program. So if that is available, that's where the X is for those drugs. So you'll see that some of those slots are blank. And that is true, that we have some medications that don't have eligible either grants or free drug. We may not have a copay card for rituximab for our indications, but there is a copay card for rituximab for rheumatology indications. So that's also why I wanted to put the caveat of neurology, like our use in neurology, because I think that's important as well. But just to give you an idea of what's out there and what we can use, it really just depends on how old the drug is, right? So if the drug has been around for a long time and they have generics, then usually the assistance for those things goes away. But brand name drugs usually have more assistance associated with them. Okay, so we've talked about all of these like types of programs for specialty drugs, infusions, or things that we're using to target the underlying reason of why you have the diagnosis. But what about assistance for all my other medications, like all the things that help with my daily symptoms? So there is assistance for those things as well. That would be in the form of copay cards, so very similar to the ones that I described before. You can have copay cards that come from drug companies or from things like GoodRx that you see like at the pharmacy or see commercials for. There are discount pharmacies, so Dr. Javed mentioned the Cost Plus drug. So that is a resource that we use pretty commonly and can have some specialty drugs on there actually. So always something good that I check and try to keep in mind. Cost Plus drugs, so they usually don't use insurance and they are a mail order pharmacy. So you will have to pay the like cash price, but you can actually look up your medication and it'll tell you an estimate of what your cost would be for either a month's supply or 3 months supply. So that's also helpful in terms of kind of anticipating cost. There is a program in North Carolina called NMOSD, and that program, what they do is they do have a set formulary or like set list of drugs that they help patients with. So it's, not every single drug that's on the market, but NMOSD will utilize free drug programs that are available through drug companies and do all of that applying for the patient and basically doing all of that enrollment to help get you access to medications that are not specialties. So like inhalers, insulin, those are just some like usually more expensive medications that still have free drug programs, but NMOSD is a good resource for that. And I think they also can supply some generics at reduced cost, and not something that a lot of people know about. Free clinics are also a possibility and also exist throughout the state. So the Lincoln Community Health Center is one that comes to mind. They're usually more like regionally located, and the clinic is usually associated with having your medical care at that location as well. So you couldn't just use it for your pharmacy services or to get drugs at a lower cost. Like you would have to see a provider there. But is a good option, especially for patients that don't have a lot of like primary cares in their area, or just like providers in general. If you have a free clinic in your area and you can use that as your primary care, that's a great option, and we can certainly send medications there as well. Okay, and also, plug for pharmacy, ask your neurology clinical pharmacist for help, your specialty pharmacist or your local pharmacist. Usually we're dealing with these insurance issues day in, day out. If we don't know the answer, we can at least know kind of where to look or where to start or help you point in the right direction, or even reach out to a colleague to help us figure out a way that we can help answer your questions. So definitely don't be shy. We love to help, and that's what we're here for.